got three stories quickly that will illustrate my concerns about healthcare reform. First is my personal story. A few months ago I was admitted and had gallbladder surgery, and the total bill was $38,000 for a very simple procedure. Fortunately, I do have health insurance, so I'm having to pay a small amount of that. But that's the size of bill that people are getting. I want to address two problem areas with healthcare with two other stories. First, there's a story of a young woman who was admitted into St. Francis, and she had respiratory problems. They wanted to rule out H1N1. They didn't know whether she had pneumonia. They weren't sure. And I took care of her for several days, and she became very concerned. She was a waitress, and she did not have health insurance, and she was getting calls from her employer while she was in the hospital asking when she was going to come back to work. And I've seen dozens and dozens of cases like this where patients leave the hospital early, or do not actually want to be admitted into the hospital because they're afraid they're going to lose their jobs. She left the hospital before she was ready, just so she could go back and keep her job and avoid having a huge medical bill. A second case was an elderly man who had serious long-term health problems and needed extensive care. He had Medicare, but his bills were really, really excessive, and he needed a lot of personal care. The social workers were talking to his brother about the brother offering financial and care support. The patient was very upset and was very embarrassed and frustrated. I see dozens of patients who are concerned because either their parents are going to have to take care of them financially and personally, their siblings are going to have to take care of them, or their children are going to have to take care of them. And these are pressures that actually cause patients to not follow care plans. They don't get the care that they need because they're concerned about these issues.